And there are some questions arise. Maybe first from Dr. Peter. To what extent the bioethics education should be implemented in non-medical disciplines? And then the next questions come from Pak Teguh to Prof. Yati. How CBMH UGM now sees its international role, at least across Asia Pacific region, especially in your position as UNESCO Chair on Bioethics.
Yeah. Okay.
Yeah. And then, oh yeah, this is the first is from Pak Peter.
Yeah. Thank you very much, Pak Peter. It's with your very good questions that also come into my my thought that to what extent bioethics should be implemented in non-medical disciplines. Yeah, as we all know that it is not easy, so it will be answered by our team, I believe. Non-medical disciplines, but yeah, actually because medical and faculty of medicine or medical doctors never work within teamwork. We always work with non-doctor, even non-medical, because the goal of the doctor to dealing with patients is not only medical problems, but environment. I think we all realize it. And also that since so that's why the bioethics teaching is also at the same policy for other disciplines in medical school, at the field. So we started from the very beginning, very early, and in trust discipline within the medical school, so that in a teamwork. So that's why should be implemented from the very beginning to all discipline which work inside the teamwork in the medical schools. And even in non-medical school, we have started to work together and teach together with all of our colleagues from other faculties and other schools. And I am inviting our colleagues, my Vika, my youngest, but I believe that she has maybe her own thought, and then others. Thank you.
Thank you, Prof. Yati. Maybe Prof. Yati would like to also answer the next question, or should we address this first?
Yeah.
Okay. Thank you for the opportunity, Prof. Yati. And the moderator, I request the permission to continue on the points that Prof. Yati has raised. It's very important. We believe for our field of work, especially in health and medicine, we already acknowledge and we are aware that solving health medical problem cannot be approached from only biological and health or medicine expertise. So we are first-hand witness that we need to approach and learn from other perspectives and with different experts. And so the idea that Prof. Yati has also raised is that in order for us to be able to communicate with the same language, we believe with bioethics principles and with bioethics concepts, that needs to be somehow be the bridge or the place where different expertise could interact. So I think that's really the main idea why we really want to push forward. We are looking for friends to work together and help us solve so many complicated problems. And so that's really the basic idea in my personal opinion. But then the practical or the pragmatic answer to the question from Dr. Peter is really what we are seeking to understand as well. Like what extent the curriculum needs to be integrated into other schools, the non-medical schools, that's really part of our aim, that we want to understand the need and also the context in different disciplines related to the dilemma and ethical problems, because we believe the language of bioethics refers to not just medical or clinical ethics, but we believe it also encompasses the different area of discipline that is related to the biological or living creatures in this universe. So it would also encompass the environmental ethics and the social ethics and policy ethics, business ethics. So there are so many areas that bioethics could be the place for interaction. So really the answer to that will be, we also hope to get the answer to the bottom of that during our project in UNESCO chair on bioethics. So I guess that's really just my idea and my understanding. So I returned, this is from Pak Teguh, but different questions. So maybe Prof. Nato would like to comment. So I will hand over to Prof. Nato for another comment.
Yeah, it is not easy, but I would like to make it easy. For example, in the presence of respect. Respect for others, it means not only respect among human, but also human and animals, and also human and plantation, and also human and environment. In this case, I think all of the faculties should start with the bioethic education, not only in health, but also in, for example, faculty of animal, yeah, and also in agriculture, for example. That is an example that we can see the importance of our student, even our teachers, to know the bioethic related to human, related to animals, related to agriculture, and also to environment. Yeah, that is.
Yeah. One more question, maybe Prof. Nato from Dr. Teguh. Prof. Yati.
Thank you, Pak Teguh. Your question is related to how CBMH-UGM, what is? Sees international role in your position as the only UNESCO chair in bioethics for the region. Yeah, as far as know that even the UNESCO Jakarta, Prof. Dr. Irakli, I think, just stated that for a moment, the region of Asia Tenggara, or maybe more, is in CBMH-UGM. But if it is wrong, I think, Pak Teguh, do you see that the UNESCO chair, not only in UGM, but also in the other centers or other universities in Asia? Maybe you can explain to us if you see that. So it is very sorry.
Yeah, Dr. Vika will add there because she is presenting.
Well, this is actually addressed to Prof. Yati. Prof. Teguh is missing Prof. Yati question to lovely Prof. Yati. So maybe it's just my personal opinion, maybe going back to our objectives for accelerating the bioethics development in the Asia Pacific region, we believe in our discussion, we believe that what we have done so far, and we have gained so many friends and partners. So we, with this UNESCO chair, we believe that it could provide the home or the forum for us to really strengthen the connection. So I don't know, maybe some may call it leadership, but then what's more important is really to work hand in hand, and then we do now have the formal place or forum or project to actually grounded our partnership, working on something tangible and with output. So I think that's really the idea why this UNESCO chair is somehow a breath of air, fresh air for our efforts, is because we now have the tangible a place project to request for partnerships and commitment from our other colleagues and collaborators. And just a little bit, just across my mind, it's really relevant to Dr. Peter's question. We cannot yet provide, I have mentioned, we cannot yet provide the extent of the practical, how far should be the bioethics education implemented in non-medical. But what we know, what we need is that at least we need to get the dialogue going. So whatever the education or curriculum will be for the non-medical disciplines, the aim is to really have this mutual understanding and mutual language in discussing the dilemmas that arise from the science and technology development and the dynamics of the society. So that's really is the bigger idea about the practicality, about the methods, the strategies that we will work on during our course of UNESCO chair. So I guess that's all my point, in my personal opinion.
Thank you, Dr. Vika, and thank you, Pak Peter. I think in addition to Dr. Vika, actually will be a good answer also from Pak Irakli, why UNESCO chair, why UNESCO, what is that? What is that? Accepted our proposal to be a UNESCO chair. That actually, so I would like to invite Prof. Pak Irakli to add our answer. Thank you very much.
Mr. Irakli, are you still with us? If you're willing to provide some short response, or because we also have limited time as well. Apparently, Mr. Irakli is not here.
I'm sorry, because time is up. So I would like to give it back to the facilitator, Puspa. Please, thank you very much. And please give applause for this discussion and speakers. Thank you so much.